Happy Monday, my loves. I hope that you all had an amazing weekend. It's me, your girl Shyla, back with another video. Today, we are going to do another trans topics video. Today, we are going to talk about boobs. We're going to talk about hormones of boobs. We're going to talk about breast augmentation because it is officially the 1-year anniversary of my girls. So we are going to talk about them. I'm going to tell you my thoughts on the end of the year. I'm going to tell you where I had them done. I'm going to tell you about the sizing, and I'm going to tell you about leading up to breast augmentation. If you're transitioning, what to expect as you start taking hormones with your boobs. So before we get going though, please take a second, hit the like button, hit the subscribe button down below. If you don't do it now, please do it by the end if you like the video. And also, don't forget to hit the little bell button. That way you're notified whenever I post new videos. If you are new here, I do post every Monday, every Friday, sometimes Wednesday. Hitting the little bell button will help you know when I do post new videos. And hitting the like button, I know a lot of people watch but don't hit the like button, but hitting the like button will definitely help get the video out there, because the more likes it gets, the more it gets noticed by YouTube and the better chance it has to get put in the trending. So please, please, please make sure you do that. If you're a returning subscriber, I appreciate every single one of you. Also, don't forget to check out my Instagram. I'm going to pop it right up here. I post there every day. Generally just once a day. And sometimes I do post polls for upcoming videos to get your guys' opinion, to see what you guys want to see. So let's get started with this. Getting boobs is probably one of the most important things, I would think, for any transgender person that is male to female. And before I get going, let me throw out a disclaimer, because I haven't done it yet, that all of these are based on my own experiences, my own opinions. I am older. I am 40 years old. As a 40-year-old transgender woman, so your experiences may be different. Your experiences may be the same. These are just my personal experiences, and everybody's are going to be different. So when you start your hormones, because you are going to be so excited to get boobs, I know that I was so excited to get boobs. The amount of breast tissue you're going to grow when you start your hormones is different depending on your genetics, depending on how old you are when you start your hormone transition. Obviously, if you're younger, you're going to probably have more breast tissue growth than if you were starting it when you're older, like I was, because I started mine when I was 40. So obviously that will play some part. Also, if you're prone in your family and your genetics to have bigger boobs, you're generally going to have bigger boobs. That being said, if you watch any girls, and I'm not going to say any names and whatever, they can get mad. If you watch any girls that say that they got like C or D boobs out of taking hormones, it's probably not accurate. The most you'll probably get is maybe a B cup if you take them for a long time and you just happen to be one of those lucky bitches that are blessed to get those. Otherwise, you're probably looking at a small A cup, maybe a big A cup, maybe a small B cup. Obviously, if you start out bigger, because I started out really big when I did this, so I had a lot of extra, I mean, I'm still big, obviously, but I had a lot of extra fat, a lot of extra everything. So when I was starting out, I could fit into like a 38 B cup. Not necessarily because I had a size B breast, but because I had so much rest of the stuff with it, I could fill up a B cup with it. So when you start your hormones, you're going to be like, oh my God, you'll catch yourself checking your boobs every single day. You're like, oh my God, is my breast tissue growing yet? Trust me, it probably isn't. Whatever you think is growing probably is not. You probably won't really notice it, because the way it's explained is it's like a little ball, which is the mass of breast tissue that grows. It's generally directly beneath the nipple is where it starts at, and then it spreads out from there. Sorry, my mind just does that. So you're going to be checking it because you're going to be like so excited for it. And I have to say, I probably didn't really notice it until after my first hormone increase, because most places, if you're doing it, if you're going to an actual doctor, they're going to start you off small in your hormones, and they're going to gradually increase them to get your body used to it, as opposed to just giving you a huge dose of the hormones all at once to start out with. So it's probably not going to start out, whatever you think in the beginning is probably not breast tissue. I was doing it all the time. I was like, oh my God, I think I felt it last night, but it's not. I can almost guarantee you it might be, but I'm going to say it probably isn't. When you are going to notice it though is when you stop checking all the time, because you just don't know anymore. You find yourself, I remember telling my friend, you know, I just don't know anymore. I don't know if it is. I don't know if it isn't. Who fucking knows what it is? But I remember the first time I found out that it actually was after, like I said, after my first hormone increase. I bumped against the wall. I had like, I don't know, like I was having trouble walking and I just bumped against the wall. No, there was no alcohol involved. And I pressed, and when I bumped against the wall, like I hit the edge of the wall and it brushed against my nipple. It's probably this wall, like right behind me. It might have been that wall as I was trying to avoid something. And it brushed my nipple and kind of pushed it, and it hurt so bad. And that was how I knew my breast tissue was growing, is that it hurt so bad. And then after that, I mean, it made my nipples more sensitive because the breast tissue is growing underneath of it. I don't know if that's just me. I already have really, really sensitive nipples, like I've said, but it definitely made them more sensitive, you know, and then getting into the other changes of the hormones, that's a topic for a different day. But breast tissue growing from there, I noticed they hurt then, and then they stopped hurting, and then they increased my hormones again when I was in about 6 months in, and they started hurting again. So they were obviously growing again, and it didn't get to be too much of a mass, maybe like this much of a mass. It wasn't huge. You know, like I said, I had a 38 B cup before my surgery, but I don't know how much of that was actually breast tissue and how much of it was just because I was fat when I started. Let's be honest. We can call it thick, but it's because I was fat when I started. Anyway, I digress. You know, even when you have them growing though, the problem with it is having boobs can definitely change the way that you're perceived. It can change the way that you feel about yourself. It can change your confidence levels, because I remember there was a lot of stuff, especially around summertime, it was like spaghetti strap that I could not wear, because I felt like if I didn't have a bra, and I always wore the Victoria's Secret Perfect Shape bra because the rounding of it made it look like I actually had boobs, just because the way it shaped everything. It made it look like it was a full boob as opposed to just like these weird pointy things, or it looks like it's too much padding. Anyway, there's my mind again, it just went bye-bye. There was so much stuff I couldn't wear, and if I wanted to wear, I mean, I had like these inserts that I would put in if I was wearing like a bralette with some stuff, just to make it look like if I had to wear something where I didn't have the padding from my bra and my confidence was gone. And I don't know, having boobs is just such a big thing for being a girl, in my opinion. And I don't want to say it and sound mean, because I know that there are girls that end up having to have surgery and have breast cancer and have to have them removed. And I don't want to say that they're like any less of a girl or anything, or make it sound like they're not. But for me personally, it was like such a big thing, especially with the rest of, especially when you're transitioning with the rest of you. It definitely can make the difference between whether or not your people, as the way they see you, as a girl, or as they don't. Because the first thing they see is your boobs, and that to them is, you know, is like, oh, okay, boobs, girl, you know, and as opposed to not, especially if you're bigger, if you're just like one of those lucky bitches that are tiny and you just look like a girl, then that's different. But if you're bigger and you're struggling with it because your body is just bigger, it can really be difficult not having boobs. So, then we get into, so I had been transitioning for about a year on my hormones before, I had been transitioning for 5 months on my hormones before I made my appointment to go do my breast augmentation. When I made the appointment, I didn't want to go someplace where I live. I wanted to go someplace and see somebody that knew what they were talking about. And when it comes to boobs, I kind of look at them as like, and this is weird, the weird way to say it, but I want you to really think about it. They're like electronics. Picking electronics is same as picking a doctor to have a surgery. You can go to Best Buy and you can get a Sony or Samsung TV and spend extra money to get the name brand, to know you're getting something good, or you can go someplace crappy and get like a shitty ass TV. Like I remember once my ex-girlfriend's mom got a Polaroid TV and it lasted like 6 months. I told her not to get it. She wanted to be cheap about it. It lasted like 6 months and it broke, and I was like, that's what you get for getting a Polaroid TV. You should have bought an expensive one. You can always find doctors that are cheaper. But when it comes to surgeries, I would rather spend more money and know that they're getting done right Not saying that cheaper ones aren't going to be done wrong, but I feel like if they're asking that much money and they're that good of a reputable doctor, that they're going to be doing a damn fucking good job on what it is. I also wanted to go to someone who specialized in transgender people, because obviously a cisgender girl's chest and a transgender girl's chest is going to be completely different. So I wanted to go someone who specialized in it, who knew what they were doing better, who... You know, I wanted someone to make me look beautiful. I wanted my boobs to look good, and my boobs do. They look amazing, and they feel amazing. So, I have silicone implants. I don't have saline. I did get 550 cc's, so which sounds big, but I am big. I weigh 240 pounds. I am not little by any means. So 550 cc comes up to about a 38D on me, and it looks right for my body shape. That was what he told me was the best, was the most that I should go with. Because they have to create a pocket that cisgender girls naturally have. They have to create a pocket for the boobs to go into, for the implants to go into, and if you go too bigger than what your skin and body is used to, it can lead you to need to have them fixed sooner, because it can cause it to mess up the pocket that's in it. And then you also have the skin in the middle that needs to stretch out. Now, I went to Dr. Scott Mosser in San Francisco. It was not cheap. I spent like $10,000, just a little bit over $10,000 for my boobs. It was not cheap. He works for Azala Medical Aesthetics. That's his company. And more importantly, he has an entire website dedicated to transgender people. He does transgender. He only does top surgeries for transgender men and transgender women. I was looking at another place that did everything, and I was thinking maybe I could go there and just get both my surgeries done when I'm ready for my bottom surgery. But I kind of didn't want to be like stuck into one place, because I had a different place in mind I wanted to go to for my bottom surgery. And I kind of wanted someone who only specialized in top surgeries. That way I knew they were putting more effort into the top surgery, because that was something they specialized in. Now, he also does other stuff. He does stuff for, you know, cisgender girls. He does breast augmentations. He does Brazilian booty lifts. He does liposuction. He does a whole bunch of other stuff. But as far as transgender, he kind of specializes in top surgeries. And I don't know if he does FFS surgery. I didn't look to see if he does the facial surgeries. But I know he does like body contouring surgeries too for transgender people. So I saw Dr. Scott Mosser. I'm going to list all of his information below, and I'm going to list the information for Azala Medical Aesthetics. They're absolutely wonderful and amazing there. If you live on the West Coast, they're in San Francisco, California, like I said, I definitely recommend you check them out. And I'll link the website that he has dedicated to transgender surgeries down below, because I can't off the top of my head think of what it is, because it's been like a year. I will say I was super nervous before I had the surgery. But it was literally one of the best things that I ever did, because as soon as the surgery was done, my confidence level spiked through the roof, just because, you know, of what I could wear, of how I felt, just everything about it was amazing. So back to the surgery. I will tell you, do not let anybody talk you. If you were a girl that's always wanted big boobs, do not let any of your friends or any of your family talk you out of, if you were thinking about a big size, don't let them talk you into a smaller size. You get the size that you want, because otherwise you're going to end up, if you go with a smaller size, you're going to regret it. I guarantee you, every girl I've ever talked to, cisgender or transgender, that wanted a bigger size and had a bigger size available and decided to go smaller because someone talked them into it, was like, I should have gone with the bigger size. Then you're going to have to go back and get surgery again. You might as well just do it all at once. Trust me. I went with the biggest size he said available. I would like them personally to be just a little bit bigger and more towards the middle, because I am bigger, so my chest is wider. So in order to put them in the right spot where they need to be in the pocket, there is a little bit of a space here. It's not terribly bad, but I wouldn't mind them being a little rounder in the middle. And he did say that he put them as far over in the middle as he possibly could without the skin that's in the middle, because the skin isn't used to being stretched with breasts, without it looking weird. But when I did see him on my last update, I think it was my 6-month checkup, he did say the skin is stretched out enough that he could actually go bigger if I wanted to. So maybe down the line in the future. Anyway, I digress. When I got them done under the over the muscle, when I went in for my surgery, he asked me that day, he said, When I get in there, I'm going to check it out because a lot of times with transgender girls, they have a lot of chest muscle because they're, you know, muscular just based on how much testosterone and how much working out they've done and how much chest muscle they have. And if you put the implants under the chest muscle, it's going to cause the chest muscle over time to flatten them out. Just because the chest muscles that's there. So he was asking me, and this is what comes down to with having someone that's more knowledgeable. He was asking me when he gets in there, if I would give him permission to put them either under the muscle or over the muscle based on what he thought was best. Obviously, there's differences with both. Over the muscle, you have the chance of rippling on the inside when you're bent over, but under the muscle, you would have the chance of it being flattened out. I would rather risk the rippling as opposed to it getting flattened out from the muscle over time. So, and I told him, I said, you know, I didn't come to you because I know what I'm doing. You get in there and you do whatever you need to do to make me beautiful. You make the choice. So, so he got in there. I ended up getting them under the muscle, over the muscle. I would recommend after you have your breast augmentation, if you are someone who works out, you don't really need to do them anymore. If you have your implants under the muscle, I would definitely not recommend working chest, is where I meant with that, not other workouts. But I mean, you don't really need to work out chest if you have them on top of the muscle. I guess you can. I guess that will lift them up some. But if you have it under the muscle, definitely don't work out your chest because you don't want to build up that muscle and push them down and squish them more. So I had them done. It was amazing. It was outpatient surgery. I was in and out for like a week. I was in and out like 4 hours, and then I spent the night in San Francisco, and then I came back home. So it was like really, really quick. It was simple. They were amazing. I didn't have any complications. I know a lot of people say that it hurts. I didn't really feel any pain. If you keep up on your pain meds, you know, and you have a decent pain tolerance, you're probably not going to feel it. The only pain that I actually felt was one instance. I was laying on the bed and I needed to get up to go to the bathroom, and I just instinctively went to push myself up with my arms, and that was when I felt the pushing motion. But other than that, I didn't feel any like pressure or pain, or for me, it didn't feel like an elephant sitting on my chest or any of the descriptions anyone said it has been. I took my pain meds for like 2.5 days. I gotta be honest, the most uncomfortable thing about the whole surgery was the stupid wrap they put around you, which was fine the first day, but then as it gradually works itself down, no matter how many times I rewrapped it, it would just keep working itself down, and next thing you know, my boobs are out. And it was so annoying at night when I would try to sleep because it would bunch up, it would get constricted. It's the worst. So, once you get your boobs done, follow your doctor's advice. Okay, follow what the doctor tells you to do. Just because you have them done doesn't mean you need to go out and have your boobs out and have no bra all the fucking time. Even though you can, because they don't really move. The better care you take of your boobs and wear bras with them, the better they're gonna sit. And the more, like mine, like if they've dropped, but they're basically in the same spot if I take my bra off as they are now. They haven't dropped very much. I haven't had any complications with them. You know, he told me even though I was past the healing point, that I should wear underwire bras whenever possible, just because it will help them stay up and it'll help them from sag or help from, you know, anything like that. So that is what I pretty much always do. I obviously don't wear one to bed because that's just uncomfortable as fuck. But you know, follow your doctor's directions. Now, as far as do I recommend it, that is completely up to you. If you feel like it's something that you want, then definitely go for it. I know a lot of people start with face first, just because face is looked at, but for me, I'm not really that uncomfortable with my face. I mean, I'm more uncomfortable with my body, and maybe that's just because I was fat for so long, like really, really fat, that my body gives me more dysphoria than my face does. I mean, I guess there's some stuff on my face I could improve, but I was more concerned with having boobs, trying to get my stomach slimmer, and then having my surgery down below. So that was the first thing that I went with, and I wrestled with the thought of, you know, especially if you're bigger, I wrestled with the thought of, I don't want to come out of surgery just looking like, and if you'll excuse the expression, I told my friends this, I know, and this is just me because I'm pretty fucking blunt about shit, so if you get offended easily, that is on you. I told my friends, I don't want to come out of surgery just looking like a fucking dude with boobs that's been put on him. That's not what I want to look like. I want to look feminine, and I'm really, and it was in my head, and I was really concerned that that was how I was going to look after surgery. I was just going to come out looking like like a big ass fucking, like a big dude with long hair and makeup with fucking boobs on him. That's what I was so worried about. I was like, I don't want to come out looking like Wesley Snipes and Tu Wong Fu, all with my fucking cannons. And I'm digressing. Not that Wesley Snipes is ever going to watch this, but I hope not. I don't want to kind of whoop my ass. But anyway, I will say that even though I had those fears, it was the best decision that I made. It helped my confidence so much. It helped everything so much. It helped me get through a lot of the dysphoria that I was having about myself and helped me towards where I wanted to be as a woman. Other than that, I don't really have anything else to say about it. Like I said, I'm going to link all of the info down below. I definitely, you know, if you're on the West Coast, I definitely recommend checking out Dr. Mosser in San Francisco because he's absolutely amazing. And if you guys like this, I'll do more like stuff about like surgeries like this because I do have my surgery coming up for my big surgery in like 4 months. So, you know, getting kind of anxious about it. Other than that, I hope you guys have a good rest of your week, and I will see you back Friday with another video. Love you all.